Welcome to Project First Line for Dental Settings, Module 2, Environment Reservoirs. In our agenda for this second module, and also in our first module, we are talking about reservoirs of germs in a healthcare setting in general, and from our understanding of these reservoirs, we are going to single out the main reservoir in dental settings. In our session today, we are going to concentrate on environment reservoirs in dental settings and how understanding these reservoirs is important to build the knowledge and the skills we need to recognize infection risks and plan our infection control actions accordingly. In healthcare, we think about germ reservoirs in the human body and in healthcare environment which means the body reservoirs and environment reservoirs. Reservoirs in the human body are the skin, the gastrointestinal system or gut, the respiratory system, and blood. Reservoirs in the healthcare environment include water and wet surfaces, dry surfaces, dirt and dust, and devices. And as the germs have their reservoirs, they also have their pathways. There are a few common pathways for germs to be spread from reservoirs in healthcare. These are touch, breathing in, splashes or sprays, and bypassing or breaking down the body's natural defenses. For instance, procedures and surgeries that require breaking a patient's skin can allow germs from the patient's skin to get into their body. Anything that we do that involves touch, whether it is touching a person or things in the environment, for example, blood pressure cuffs, or if you want to talk about a dental setting, so like any part of the dental unit or any dental instrument or devices, can be a risk for germs to spread. Infection control actions at any of the key points we just discussed can stop germs from spreading and causing infection. To make decisions about infection control, it is important to think about where the germs are, which reservoir or reservoirs you are dealing with, and then how the germs might get somewhere else, which is the pathway. Then you can recognize the risk for germs spread to happen and do something about it, which is the infection control action, the effective infection control action for this situation. Now let's talk about the four dental healthcare environment reservoirs. Germs are part of everyday life. The world is covered in germs, especially in healthcare, including dental settings. When we think about where germs live in the dental healthcare environment and the steps we can take to keep germs from spreading, we think of four core environment reservoirs. First, water and wet surfaces. In a dental setting, we focus on the dental unit water lines and treatment water, as with handpiece and scalers, and also sinks and faucets drains. Second is dry surfaces. The most common dry surfaces we see in the dental setting are the dental chair, light, handles, countertops, and instrument trays. The third environment reservoir is dirt and dust that can be found in a dental setting with any construction or repair. And lastly, devices with many examples since dentistry is a very instrument and equipment dependent care. These aren't the only places where you can find germs in the healthcare environment, but we will focus on them for our discussion about infection control because they are common sources of possible germ spread. The definitions of these reservoirs are mostly self explanatory. So, today we will discuss why they are important and how we can use our knowledge about them to recognize the risks for germs to spread. Before we move forward with more details about these reservoirs, let's first understand why it is common to have germs in the dental environment. Let's review some of the main factors for germ persistence in dental settings. Dental procedures are open and invasive by nature, including routine procedures like teeth extraction and periodontal procedures. We also know from our previous module, which was body reservoirs, why the mouth is a reservoir for many germs, including the oral microbiota, non-oral pathogens, and blood-borne pathogens, which are the most concerning due to potential contact with HIV, hepatitis B, and hepatitis C viruses. Another important reason is the use of water in most dental procedures, which makes it more possible to have reservoirs for germs. Splashes and sprays are also part of many dental procedures and they are a major pathway of germs transmission. Also, dental unit water lines are considered a significant infection risks because of biofilm formation and water stagnation in these water lines. The fact that dental care is instrument and equipment dependent is another reason, as the more instruments that are used, the more contamination is happening and more pathways are available for germs to spread. Our concern for germ spread is through the touch pathway or breaking down and bypassing the body defenses through the use of sharp instruments. Finally, poor infection control practices can lead to germs persisting in the environment on objects and surfaces for days, weeks, or months. The lack of compliance with infection control guidelines and recommendations still occur among dental health care personnel, and that's why it is so important to continue training about infection control risks and actions that you can take to prevent the spread of germs. Let's talk about the first environment reservoir, which is water and wet surfaces. Water and wet surfaces can be ideal places for germs to grow. Water is used in many ways in dental settings. The most important is dental treatment water, which is the water of the dental unit. In many dental procedures, it is mandatory to use water to reduce the heat that is produced from friction with teeth surfaces from equipments like high-speed handpiece and the ultrasonic scaler, as this heat can damage the pulp of the teeth. Also, treatment water is commonly used to rinse and irrigate the mouth in different procedures. And since this water is non-sterile, it can be a good place for germs to grow. Many reports and studies have related infections outbreak in dental settings to treatment water and its water lines in the dental unit. The other type of water or the other way of water used in a dental setting is tap water that is used for washing hands or for washing dental instruments before sterilization. Tap water is also used a lot for dental lab work, as for example, when preparing impressions or making casts. The third way of water use in a dental setting is the sterile water that is used for surgical procedures and periodontal procedures, and even in non surgical procedures as endodontic and pulpal treatments. However, even when sterile water is not itself a reservoir for germs, splatters associated with these procedures can carry different pathogens and can be a pathway of transmission for these pathogens to dental healthcare personnel and to other surfaces. Dental unit water lines typically cannot be sterilized. However, they should be routinely cleaned and disinfected. Without proper cleaning and disinfection, Waterborne microorganisms can get accumulated in the dental unit water lines and form what is called a biofilm, which is a layer of microorganisms adhered to the surface of the dental unit water line. This layer can become dislodged and enter the water stream, causing contamination of water. Some of these microorganisms can be pathogenic, especially for vulnerable patients. Example of the pathogens that were found in dental water lines are Legionella, Pseudomonas aeruginosa, non-tuberculous mycobacteria, some types of fungus as Candida albicans and Candida guillermondi, some other pathogens that can be found in wet surfaces other than the dental water lines are Acinetobacter and Serratia. The main pathways we have for the transmission from water and wet surface reservoirs are first, touch. When dental healthcare personnel touch these wet surfaces by their hands or gloves, or when dental instruments get wet and can then grow germs that can spread to the patients. The other pathway is splashes and sprays, through which droplets can enter the mucous membrane of your mouth, eyes, or nose, and also on your skin and even on instruments. Breathing in is another possible pathway for pathogens in water reservoirs to spread. When water gets into the air as very small droplets, it can be breathed in and carry germs to the respiratory system. And finally, or the final pathway we have, is breaking down or passing the body defenses as when using non-sterile water in surgical, periodontal, or endodontic procedures. Now, what infection control actions we think about when dealing with water and wet reservoirs? First, clean hands, clean and disinfect surfaces, sterilize high-risk devices, use personal protective equipment, PPE, such as gloves, protective clothing, and respiratory and eye protection. Use surface barriers to protect clinical contact surfaces from sprays and splashes. And finally, follow recommendations for safe dental treatment water in the dental unit water lines. Now let's go to the second reservoir, which is dry surfaces reservoirs. These reservoirs include high-touch surfaces, like, for example, the dental chair arms and headset, the light handle, and the instrument tray. Door handles, as well as surfaces like countertops, computers, tablets, are all possible reservoirs. Dry reservoirs can also include soft surfaces like curtains and sofas. Many germs found in the mouth, in the air, and on the skin can end up on dry surfaces, and then they can spread very easily to other people or to other surfaces. Hands can pick up germs and move them to other surfaces and to other people. Germs from dry surfaces can also get on dental instruments and can be spread when those instruments are used on or in the patient. Now let's see how germs spread from dry surfaces reservoirs. Germs can be found on dry surfaces and can survive or persist from a few hours to several months. Example of the germs that can be found on dry surfaces in a dental setting include bacteria, as Staphylococcus species, including methicillin-resistant Staphylococcus aureus, or what we know as MRSA, Also, Streptococcus, Pseudomonas, Bacillus, and Micrococcus bacteria are other species that can be found on dry surfaces in a dental setting. Examples of viruses include respiratory viruses such as SARS-CoV-2, influenza viruses, and rhinovirus. Blood-borne viruses as HIV, hepatitis B, and hepatitis C viruses can also spread from dry surfaces. Herpes viruses such as herpes simplex virus type 1 can also survive on dry surfaces, as well as norovirus and Coxsackie virus. The pathways for germs to spread from dry surfaces are: first, we have through touch, particularly high touch surfaces. Oftentimes, healthcare workers will touch surfaces with their hands and then spread those germs to other surfaces, people, or even to devices and instruments. For example, a dental mirror that was contaminated by the hand of a dental healthcare worker could touch the mucous membrane of the mouth and spread germs to the patient. Another pathway is breaking down or bypassing the body defenses from contaminated dry surfaces to instruments. This would include germs spreading from needles, surgical, and periodontal instruments. Now, let's see what infection control actions we think about when dealing with dry surface reservoirs. First and always, clean hands. Second, clean and disinfect surfaces. Sterilize high-risk devices. Use appropriate PPE. Use surface barriers to protect clinical contact surfaces from sprays and splashes. And finally, follow facility procedures and guidelines. Now let's talk about the third environment reservoir, which is dirt and dust. Outdoor construction projects near any healthcare facility, including dental facilities, or indoor projects like building maintenance or renovation, can send dirt and dust into the air. Germs and dirt and dust can harm vulnerable patients. Some common types of pathogens in dirt and dust are fungi, like Aspergillus, that can cause infections in the sinuses and in the lungs when breathed in. Another example is Cryptococcus, which is another fungus that can cause Cryptococcus meningitis when its spores are breathed in. The germs in dirt and dust can harm certain patients if they are breathed in. The germs can also spread by touch, especially by hands, when dirt and dust land on surfaces and devices. If the germs are spread to central lines or wounds, they can get into the patient's body and cause infections. Infection control actions that can help stop the spread of germs from dirt and dust include clean hands, clean and disinfect surfaces and devices, ensure good ventilation, use barriers and other construction containment. The last environment reservoir we are going to talk about is device reservoirs, which include our dental instruments and equipment. Dental healthcare personnel use dental instruments and devices for any dental service provided, several times a day and for different patients. The multi-use of shared equipment makes these devices and instrument reservoirs for germs and can pose infection risks for patients and to the healthcare workers. Dental instruments and devices are classified into categories based on the degree of risk for infection involved in the use of these items. These categories are critical, which include devices used in a patient's body that penetrate soft tissues or enter the blood. Examples of critical devices in a dental setting include needles, endodontic, periodontal, and surgical instruments. Implants are also considered critical because they become in contact with the bone. Semi-critical devices are those used on a patient's body that directly contact the mucous membrane or non-intact skin. Examples include the dental mouth mirror, impressionist trays, and the handpiece. And the final category is non-critical devices, which include the instruments that are used on a patient's body and touch intact skin. Examples are the dental radiograph cone, a blood pressure cuff, and an oximeter. Examples of germs that can contaminate devices and instruments and grow on them include blood-borne pathogens, mainly the HIV virus, also hepatitis B and hepatitis C viruses. Reports and studies have also shown contamination of dental instruments with some types of bacteria and other viruses, like herpes simplex type 1 virus. The main pathway of transmission here are breaking down or bypassing the body's defenses and also by touch. When devices and instruments are used on the tissue of the mouth or penetrate them, they can be an entryway for germs into the body. Dental devices and instruments can also pick up germs from the patient, and if these devices and instruments aren't sterilized or disinfected in the correct way, they can carry germs to other surfaces and to other patients. Infection control actions that can help stop spread of infections from dental instruments, devices, and equipment include clean hands, clean and disinfect devices, sterilize high-risk devices, and use appropriate PPE or personal protective equipment. At the end of our module, here are some key takeaways from the content we covered today. Reservoirs are the places on and in our bodies and in the environment where germs live. Germs frequently spread between and among these reservoirs. Four reservoirs in the healthcare environment that are important for infection control are water and wet surfaces, dry surfaces, dirt and dust, and finally instrument and devices. Because of the nature of dental care, environment reservoirs for germs and pathways of transmission are present in any dental setting. Understanding where germs live and how they spread help us build and integrate effective infection control actions. Even though we covered a lot today, there is still much more to learn. You can keep exploring these topics on your own using the resources on this slide. Project First Line has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project First Line on social media. On this slide, you can also find some resources that are specific for dental settings. And that's it for our module for today. Thank you.